you have a foot fetish?
Oh, so you're going into podiatry. That's awesome. I love kids.
Podiatry, podiatry, arthropod, pseudopod, podocyte, cephalopod, tripod. Pod means foot.
Foot fetish.
They're not real doctors. They didn't even go through that much training.
Foot fetish.
Podiatrists think they're orthopedic surgeons, but they're not.
Foot fetish.
You want to go into feet? Feet are gross.
I mean, you could become an otolaryngologist and pull a moldy crayon out of some kid's nose. Maybe a gastroenterologist and do a colonoscopy. You could go into urology and deal with urethral issues. Or like an OBGYN and everything that comes with that. I'm sorry if you didn't know, but medicine's just kind of gross.
A podiatrist is actually a doctor of podiatric medicine. They are a physician and surgeon that treats the foot, ankle, and related structures of the leg. In this video, learn all things podiatric medicine from current students and a podiatric physician as we dive further into the pathway to becoming a DPM, what student life is like, what academics are like, and student testimonies. But you don't want to hear it all from me. Let's hear from the students.
I learned about podiatry in my senior year of college, and I'm so grateful that I did. The idea of helping patients have a better quality of life by facilitating healing in our feet, the body parts that literally carry the entire weight of our being, is what excites me most about podiatric medicine and surgery. Podiatric physicians save feet, save limbs, and save lives.
One of the reasons I personally chose podiatry was because of the significance that you could have on somebody trying to optimize their athletic performance or even just their day-to-day performance, all by focusing on the lower extremity. And now that I'm a student right now, you can see the ability that you are able to learn from other students, other patients, all through their perspective and how they live their experiences in life. And you get all these little informations to get this big pool of knowledge, and you get to share your knowledge. It's a really beautiful thing.
I chose to pursue a career in podiatric medicine because I love the flexibility it grants me to pursue my passions such as sports medicine, diabetic wound care, and it also gives me the ability to do surgery. From shadowing, I was able to witness firsthand how quickly you were able to improve the lives of your patients with just a simple office visit, and I hope to achieve that in the future with all my patients.
My name is Nicole Pham, and I am a third-year podiatric medical student, and I chose podiatric medicine because I love the diversity of patients that we see. I love being able to help children, like babies with club feet, to the elderly, and all the people in between as well. What's great about podiatry is just the diversity of patients, making clinics so interesting, and all of the clinical cases that we see are so varied, and it makes each day unique from the next.
As a child, I had many follow-up appointments with a podiatric physician, and in college I also shadowed a podiatric physician to make sure I really enjoyed the field. What I found was a healthy work-life balance was very important to me in my career choice. I don't want to have to be able to sacrifice time away from those I love in order to do what I love.
Hi everyone, my name is Stephanie and I'm a second-year student at CSPM. My decision to pursue podiatric medicine was solidified after I shadowed a DPM. I loved how they were not only able to provide immediate relief for their patients, but also they were able to maintain a long-term relationship with their patients. Additionally, the patient population is super diverse. Everyone has feet, so I can work with all ages ranging from babies to the elderly. So if you're interested in learning more, check out this video by Dr. Tran on how to become a podiatric physician.
Hello everyone, I am Dr. David Tran, and I'm with the California School of Podiatric Medicine at Samuel Merritt University, otherwise known as CSPM. I am the Associate Dean for the Office of Admission, as well as being an assistant professor within the Podiatric Medicine Department. In addition, I'm also the Graduate Placement Director for the program at CSPM, and I'm delighted to be here with you.
Hello, everyone. Thank you for joining us, and I am delighted to be here to share with you about the wonderful profession of podiatric medicine and surgery. Let's talk about how we get to become a podiatric physician and surgeon, namely a DPM, which stands for Doctor of Podiatric Medicine. A DPM is a physician and surgeon who specializes in the treatment of pathologies that involve the lower extremities. This means the foot and ankle and all of the soft tissue structures that control the function of the foot and ankle. Before we get into the nitty-gritty of how to become a DPM, let me briefly share with you where I'm hailing from. I'm from the California School of Podiatric Medicine at Samuel Merritt University, otherwise known as CSPM, which is located in Northern California, in particular the San Francisco, Oakland Bay Area. CSPM is based on our Oakland, San Francisco campus. We are geographically located in a multicultural environment where diversity and inclusiveness is a mainstay of everyday life. Our campus is but a short 15 to 20 minutes hop to actual downtown San Francisco. CSPM focuses on small class sizes, which is capped at 48 students per fall entering class. Our emphasis is on individualized podiatric small group teaching, as well as early clinical exposure. CSPM is nationally recognized for our biomechanics and sports medicine, and we offer state-of-the-art learning in our simulation learning labs, as well as our technology-filled Motion Analysis Research Center, otherwise known as the MARC. So now let's take a look at the timeline of how to obtain your DPM degree. The podiatric medical education is no different than that of an MD or a DO program in that medical school takes 4 years. The difference is that your medical schooling begins with a specialization process at the get-go. The nice thing about podiatric medicine, however, is that once you have successfully completed medical school and you enter into your residency training, your training guarantees you your surgical specialty. You therefore will become both a physician and a surgeon. In contrast, surgical training is not guaranteed to you with the MD or DO pathway once you graduate from medical schooling. Your podiatric medical education curriculum mirrors pretty closely to that of the MD-DO program, with the differences being areas of your focus specialization within podiatry, such as low extremity anatomy, biomechanics, sports medicine, podiatric medicine, trauma, etc. Once you have completed your medical schooling and have passed all of the necessary boards, you will then graduate with your DPM degree and enter into your residency training. Your residency training is 3 years in duration. The training usually embraces a multi-interdisciplinary training approach within your first year and will focus more into podiatric medicine and surgery in years 2 and 3. Once you have successfully completed your residency training, you are then qualified to enter into practice. For some folks, they may wish to pursue additional fellowship training, but that is not required for entering into practice. So the next question is, where can you practice? You really do have a wealth of choices and options that are available to you in terms of arenas that you may find enjoyment in practicing. This slide here outlines a collection of some of those options for you. So, what are some of the benefits of becoming a DPM as opposed to following the MD or DO route. One of the biggest benefit and difference up to this point in time that we have discussed is that you are guaranteed the surgical training and practice by following the DPM program. This slide also shares with you some of the other benefits of this great profession, with an emphasis for a balanced lifestyle that embraces opportunities for family development. By this point, I'm sure that all of you are clamoring to ask, well, how do I actually become a DPM? I am so very glad you asked. Let's dive in, shall we? Let's first review some basics. By now, you are aware that the DPM pathway is distinct and different from that of the MD-DO pathway. As the schooling is specialized, it is only offered at podiatric medical schools and not at your traditional MD or DO schools. There are only 9 podiatric medical schools across the United States. CSPM is located in Northern California. You can find detailed contact information for CSPM as well as for each of the other DPM colleges at the American Association of Colleges of Podiatric Medicine. The link to actually apply may also be found at the association's website. The application process is via a centralized application service, often referred to as the CAS. You can access that application portal at the AACPM home website. The admission cycle for podiatry is unrolling in nature and usually opens in August and goes through till June, with admission into the program occurring in August of the cycle year. A quick word of caution about late applications. Even though admission is unrolling, do not delay your application, as seats at the various schools may be filled early in the application cycle, and you may be waitlisted as a result of applying later in the cycle. The core of your application includes the prerequisites of the sciences, their respective labs, such as biology, chemistry, organic chemistry, physics, and the liberal arts. The MCAT is a requirement. Your transcripts and letters of recommendations must be directed to the CAS for review and processing. Most schools do require letters of recommendations. These letters may be uploaded to the CAS by your designated authors. For those students that are unable to direct their letters from Interfolio to the CAS, some schools will permit and accept the letters to be directly submitted to them from Interfolio. From this slide, you will note that a letter of introduction is required from a DPM. So the question is, how do you go about obtaining such a letter? The DPM Mentors Network is a great resource to identify DPMs close to where you live in order to shadow and to obtain the letter of introduction for your application. You should not be afraid to reach out to your friendly local podiatrist. They are usually very friendly and welcoming to prospective students who show a passionate interest in pursuing the profession. Once you have completed the submission of your application, the CAS will process it and forward your application to the schools that you have designated. Even though your application may reach the school's portal, admission traffic rules prohibit the full processing of your application until it becomes verified by the CAS. So please keep an eye on your application processing timeline from the CAS and to respond to any inquiries that they may send you. Once your application is verified, the medical schools will then proceed to process it, and if you are eligible, they will then extend to you an interview opportunity with them. Well, folks, we have covered quite a significant amount of information in a very short period of time. In the event that you should have any additional questions about materials that we have touched upon or topics that we have not discussed, please feel free to reach out to me. Thank you so much for your attention, and take care.
Unfortunately, we are not able to show pictures from inside the lab, but one of students' favorite classes is anatomy. We love to learn about the amazing structures and functions of the human body. Other courses that may not be as enjoyable end up taking a lot of your study time. These difficult subjects may include biochemistry, physiology, and histology, among others. One of the great things about podiatric medicine is being hands-on with each patient. Since this is a great focus of the profession, it appears early in your education. Just in your first year at CSPM, you will take hands-on classes, such as biomechanics and introduction to clinical medicine.
Regular calcaneus, but when she relaxes, it's an everted calcaneus. So that is a component of her, obviously, flat foot here. She has a lower arch here. I'm going to move you back out again, a little bit more. So in more. Okay, isn't that pretty? Look at that, that's fantastic. Okay, so in this instance, she has subtalar joint pronation. That's the word you guys have always heard.
At CSPM in biomechanics, you'll be learning different things such as casting, inserting orthotics, and you will also be participating in research at the MARC lab, in which you take biomechanics and understand how to further develop things such as shoe orthotics.
Like on this one here, see I'm going into the center. You see how you get the corner? I went into the center, right? But I want to get the corner out, so I got to put the other point in the spike.
You do go to all the way to
you can do the other side with your other hand. Same thing, right? The pressure. See, you kind of give you dexterous, right? If you really can't do it, you can just try and get the nail down with that, but you should try and do it with hands. I'm going to
No, how can you tell she's long? You're just looking at the toe. You look at the knuckles. It's not bad because there's a knuckle, there's a knuckle. So the metatarsal length is probably fine. So her metatarsal parabola looks pretty good. But watch when she stands up. See, look at this. Look at this. No, she has first metatarsal is elevated. Yeah, first metatarsal insufficiency or the white spots in their center. Yeah, it's an IPK. What does that mean? It's an intractable plantar keratosis. It's like a dilated pore that the dead skin keeps falling into.
Oh yeah,
so hers is pretty deep. Yeah.
Beginning the summer after your first year at CSPM, you will begin clinical rotations. These rotations include San Francisco General Hospital, Highland Hospital in Oakland, Homeless Clinic, Biomechanics, Clinical Skills, Simulation Center, General Medicine, and Radiology.
She's alive!
feel that arc, and then just let it drop down. It's like the pressure is so light against the skin. It just falls into that position, and then any more I'd have to push it to get to the other side. You can go the other way. You can start on the supinated side, let it drop down into neutral, and then have to pull it. So you can either push it or pull it, but it's getting a feel for that arc, and like just the bottom of it is the neutral position of the subtalar joint.
Studying will take up much of your time. Many people study alone or in groups. Sometimes you may even find yourself sleeping when you should be studying.
So coming home to study isn't that successful because we just sleep.
You will find that although much of your time is taken up in studying and preparing to become a physician, you still have a life. Here are students using their free time to go rock climbing together. Other students use their free time to participate in the local adult soccer league with the team that is made up of the multidisciplinary students of Samuel Merritt University. Each year, the 9 schools of podiatric medicine participate in a basketball tournament. In the most recent tournament, our women's team brought the trophy back from Nashville to the Bay Area.
Great job. I wish we could have been in Nashville to watch, but can't do that. Where are you going to play next year?
Nashville. It's going to be
always in Nashville.
How about the year after?
Nashville.
Sounds like Western. Where is it?
In California. All right, and we're looking to starting scholarships, so we can become a D1 team.
Now go on full ride.
You only get one if you grow.
Big plans.
You only get one if you grow.
If you grow. All right. So I think this is the first time the women's team has won the national championship. Yeah, so really, congratulations.
While we are sure that the other 8 schools are great, they don't compare to the food options we love to explore here in Northern California. Many of our students use their free time finding exciting new places to eat fantastic food. Many of our students have found time throughout the school year to get out and explore nature, from beautiful hikes to stunning sunsets to relaxing nights under the stars. It is always nice on a weekend or the evening after a test to get out with classmates and have a good time. Clubs are a great way to be involved on campus. Many clubs include learning hands-on skills like injections, taping, or casting. Other clubs focus on teaching others about the profession of podiatry. There's a club for everyone at CSPM.
You see the pressure here? There's like almost no pressure on your arch.
Podiatry school and student life can be great, but what happens when school is over as well as residency? Find out in this next segment a variety of different subspecialties that podiatric medicine has to offer.
There are many important subspecialties in the field of podiatric medicine. One such is biomechanics. Biomechanics is studied to determine the movement of the ankle, toes, and the foot, as well as the forces that impact them. Another important specialty in podiatry is podopediatrics. A podopediatrician is both a podiatrist and a pediatric specialist, and they have the ability to help guide a child's foot in proper development. In some of these photos, you can see how CSPM students have helped casting for podopediatrics. We also have a Podopeds club. Along with that, we have one of our junior CSPM fans showing her very cute little feet. A well-known specialty in podiatric medicine is also sports medicine. A sports podiatrist is not only a foot doctor familiar with sports, but also a highly trained specialist who understands sports injuries and sports performance in athletes. In these pictures, you can see CSPM students who volunteered at the local Napa Valley Marathon and their passion for sports medicine. Surgery is one of the most important aspects of podiatry. In this next video, you'll see an Achilles tendon repair surgery done by Dr. Kira Kosian at the DVASF residency program. Another important aspect to podiatric medicine is the aspect of research. As we know, research is very important in all medical fields. Specifically at CSPM, we have a whole MARC lab that is dedicated for students and faculty to work together to conduct new research for podiatric medicine.
Research is good for evidence-based medicine. Especially with podiatry, a lot of the stuff that we did before wasn't really evidence-based, as and I say before as in a couple decades ago. Now as we move, come into 2020 and the early 2000s, we were able to finally, get some solid research projects done due to the funding that we got from industry to kind of get some of this stuff done, which also can create bias as well. So now we're trying to get a lot of, governmental grants and things like that to get, really good unbiased research without industry favorite results type of things, getting that done. But research, is for evidence-based, it's in the words evidence-based. So those clinical decisions that you make will have to be based on the evidence that's in the literature and the medicine, not just something that, my Uncle Stan, who was a podiatrist down the street, told me to do. You have to do something that's going to be, longevity with solid, conclusions and questions that have to be answered.
Hi, my name is Sherry Choate. I'm the Associate Dean for Educational Affairs at CSPM. Diabetic and wound care is a large part of the podiatric professional's life. Patients with diabetes have frequently a loss of sensation in their feet, which leads to chronic wounds and recurrent wounds for patients. The important role that we play in these patients is that we help focus on limb preservation. That means keeping their limb, not letting their wound get infected, and attempting to stop amputations from happening as possible. We also play a big role because we focus on the biomechanics of the limb, helping with taking weight off the limb, whether it be temporarily while wound is healing, or long-term with modification with orthotics and shoes so that patients are less likely to have their wounds occur over and over again in their future. Thank you.
See, there's more to podiatric medicine than just feet. Check out these testimonies as we ask the same questions to first years all the way to practicing podiatric physicians about what they think about their decisions.
What I really admire about podiatric medicine is the beautiful artistry ingrained in its surgical techniques and procedures. And I am so grateful for all the challenges I faced so far in my medical career because I believe it has prepared me well for this new chapter as a podiatric medical student. And if I were to go back in time and do it all over again, I would always choose and will always choose podiatric medicine.
Currently, I am preparing to start clinic rotations, and I am very excited to start these rotations with my group and to be able to apply the information we are learning. I've only heard some of the good things from other groups, and it'll be a nice experience for myself. Right now, we're taking Podiatric Medicine 1, and I found this class very interesting. We are being introduced into common drugs, common injuries, as well as revisiting some of the things we learned our first year. I would say I'm enjoying my medical career at CSPM thus far, and would I do it again? Most definitely. I can have asked for a better class to be on this journey with, and I look forward to seeing what's next.
So, I took my boards a little over a month ago, and I am so relieved to be done with part 1. Boards honestly took over my life for the last 2 months, so it feels so good to be done, and it's crazy to think back and see how much I've learned over these past 2 years at CSPM. I'm finally back on rotations and able to see my clinic mates and learn things and learn clinical skills that I'm going to use moving forward. And I really didn't realize how much I missed interacting with them and learning about different kinds of cases. I chose podiatric medicine because I've always been fascinated by sports injuries, and I grew up playing sports, and had quite a few injuries myself, so I always was curious about why the body failed. When you look at the human body, it's really a marvel, all the things that it can do and withstand, but obviously sometimes it fails, and I really wanted to know why. And I chose podiatry because it lets me figure out why, and it lets me do it in a way that's really, really focused on the lower extremity, which is absolutely necessary in all walks of life, and especially when it comes to sports injuries, that's something that gets injured quite often. And so podiatric medicine lets me not only treat sports injuries, but so many different kinds of diseases and injuries. So I get to have a variety of cases that I treat, and I get to spend 4 years learning about the lower extremity and the injuries that plague it instead of just focusing, 1 or 2 years in fellowship. So I get to become an expert in a field that's critical to being able to treat sports injuries.
All right, so my favorite thing in PodMed is actually the variety of things you get to do. So anywhere from wound care, sports medicine, biomechanics, trauma, surgery. I also like the aspect that the profession is really small, so you can sort of communicate with a lot of people, get to know a lot of individuals out there, and while even working through clinic as a student, you get to see how many physicians work across the country, trying to get advice on special cases like, hey, what am I doing wrong here, or what can I do here differently to help patients? And I think that's very unique.
Hi, I'm Sim. I'm a first-year resident at Carillion Clinic in Virginia. It's been a really great experience so far. Being a resident is a whole new level of responsibility. It's much better than being a fourth-year student. You work hard all year, and you finally get that payoff, and you're actually working now, and you're responsible for patients, and you're in surgery, and it's on you. It gets very real very fast. It's a great challenge. My program specifically, we have a lot of trauma that comes through the ED. So you kind of working on your feet, learning how to reduce ankles, fixing ankles, that kind of stuff. But yeah, residency has been a great experience so far. It's been a challenge, but that's what you want in residency. You want it to make you better. You want it to. You have to be at the top of your game.
Hi, my name is Dr. Fong Lee from Northern California Orthopedic Associates. So the favorite thing I love about our profession in podiatric medicine and surgery is getting patients back on their feet. If it's something as little as someone coming in with an ingrown toenail that we're able to treat immediately and get them back on their feet versus something more serious like patients sustaining a severe sports injury like Achilles tendon rupture, and we're able to set them up for surgery, get them back on their feet sooner than later. We have these techniques nowadays where surgery is minimally invasive. We're able to get patients back about 9 to 10 months after their surgery and get them back to their sport. There are things in regards to complex conditions or trauma that we deal with on a day-to-day basis. The patient comes in with a complex tremor ankle fracture, dislocation that we see in the office. I love these conditions because patients come in with a severe condition. Unfortunately, a bad accident or injury occurred, and we're kind of like their savior. We're able to help them, set them up for surgery, get them surgically repaired as soon as possible, and get them back on their feet. I feel these patients are very thankful because we did everything we could to help them preserve their leg and also get them back to their sport or activity or just being able to walk on a day-to-day basis versus having this dislocation of their ankle.
I chose podiatric medicine because I love how it can help patients take back control of their lives that they lost from their injuries or diseases related to their feet and ankles.
I chose podiatric medicine because it combines different aspects of healthcare that I am drawn to. Prior to starting at CSPM, I was able to shadow different specialties in which I learned about being in the OR, anesthesiology, a little bit about the physical rehab process, and clubfoot. By the time I got to podiatry, it just felt most natural and I didn't have to think twice about it. What I enjoyed most about podiatric medicine is seeing the relationships built between the podiatrist and the patient, and I hope that one day I'll get to experience that for myself.
My favorite thing about podiatric medicine is the kinds of relationships you get to develop with your patients. you're with your patients from day one because you're also their treating physician. You're in clinic with them. So from the moment that they come to you with a problem, you're with them until the end of the problem. So even in surgery, you're with them through that, and then you get to see what their recovery is like. So you really get to develop this special bond with patients, and I think that's something really unique to podiatric medicine, and it's one of the reasons that I decided to choose this field.
I chose podiatric medicine because it has a large variety of things and a lot of scopes that you can do, such as trauma, dermatology, orthopedic surgery like bone saw work. You can do general medicine workup, routine foot care stuff, work with diabetic populations, all of which I was always interested in when I was applying for medical school. But when I discovered podiatry, I saw that you could do all of that I was interested in, like I mentioned, like dermatology, orthopedics, general medicine, the whole works. So that's why I chose podiatric medicine.
So I chose podiatric medicine because I was working as a medical assistant for about a year, and I would ask the surgeons at the surgery center if I could shadow them. And I ended up shadowing all different specialties. The podiatrists were the happiest. And I asked them why. And he said because we fix people's problems, patients are generally pretty happy with us. And then we also get to have a life outside of medicine, which is what I wanted. I want to one day have a family, I want to do surgery, and I want to be able to see my family. So podiatry really checked those boxes for me, which is why I'm here today.
The reason I chose podiatric medicine is I believe it's medicine's best kept secret. This profession allows you to become a physician and surgeon who has the flexibility to both treat patients conservatively and surgically when needed. I deal with a lot of different variety of patients coming in from as small as something like a painful ingrown toenail that you can treat and get them back on their feet immediately, or something in regard to trauma where the patient comes in with a fracture dislocation and you're able to help that patient get back on their foot and ankle by surgically repairing that limb and going through the steps in recovery, getting them back to where they need to be in order to walk and get back to any sports or activities that they were involved with at any period of time in their life.